If you've ever felt the sudden, absolutely agonizing pain of a gout flare-up, well, you know you need relief and you need it yesterday, right? That is exactly where colchicine comes into play. Let's jump right into this explainer and figure out exactly how to wield this really powerful gout-fighting medication safely and effectively. Quick roadmap for us today. We're gonna meet your gout match, figure out who can actually take colchicine, nail down how to safely dose it, go over warning signs and side effects, and finally, look at some crucial medication interactions. Section 1. Meet your gout match, understanding the enemy. So before we get into the medication itself, we kind of have to understand the condition. We know the villain here, right? It's those jagged uric acid crystals building up and causing just explosive, severe inflammation in your joints, usually that big toe. Well, colchicine is the hero, designed to step in and directly neutralize that debilitating inflammation. And the timeline for that relief is honestly incredibly fast. It's almost like a magic trick. The medication actively starts working in as little as 30 minutes. Within 2 hours, you're hitting the maximum initial onset. And by the 48-hour mark, so after taking it for a day or two, the pain usually starts to significantly drop off. It's fast-acting relief right when you need it most. Section 2. Who can take colchicine? Establishing the boundaries. Okay, so most adults 18 and older can safely take this stuff, and specialists will sometimes even prescribe it for kids. But, and this is a massive but, it is absolutely restricted for anyone with severe blood disorders, severe kidney or liver problems, or if you're pregnant, think you might be pregnant, or are currently trying for a baby. Total no-go in those cases. Building on that, there are a few other medical red flags you need to discuss with your healthcare provider. You absolutely have to flag your doctor if you have any history of heart or digestive system problems. Also, let them know if you have low white or red blood cell counts, low blood platelets, or, any bone marrow function issues. And naturally, if you've ever had an allergic reaction to colchicine or similar drugs in the past, they definitely need to know that to make sure this is actually safe for you. Section 3. Safely dosing your medication, the strict protocol. 500. I want you to literally cement this number in your brain. Colchicine comes in 500 microgram tablets. Remembering this specific dosage size is your absolute first step to safe and accurate dosing. Now, how exactly do we take it? Well, your doctor is going to dictate the exact length and frequency, especially if you have, say, mild kidney or liver issues where they might prescribe a lower dose and monitor you. But for a standard run-of-the-mill gout attack, the usual protocol is taking one 500 microgram tablet 2 to 4 times a day. You just swallow the tablet whole with a glass of water, and generally you're only going to take it for a few days. But hey, life gets busy. What happens if you miss a dose? The protocol here is incredibly strict. Step 1, take it as soon as you remember. Step 2, if it's already nearly time for your next dose, just skip the missed one. Step 3, resume your usual schedule. And step 4, this is the absolute golden rule, folks. Never, ever take a double or extra dose to make up for a forgotten one. Just don't do it. Why are we so rigid about that rule? Because overdosing on this medication is extremely dangerous. If you start experiencing vomiting, severe stomach aches, bloody diarrhea, or signs of low blood pressure like feeling super dizzy or lightheaded, treat it as a medical emergency immediately. You really have to stick strictly to the script. Section 4. Warning signs and side effects. Your body's warning lights. Please, never just brush off mild side effects. With a medicine as powerful as colchicine, minor discomforts can actually be the very first warning sign of a much larger underlying issue. So always seek medical attention rather than just trying to tough it out.
So here's your checklist of warning lights to watch out for. Get medical help if you feel sick, start vomiting, or have stomach pain or diarrhea. Also keep an eye out for a high temperature, a sore throat, a swollen mouth, or any bleeding that just won't stop. Most importantly, keep a really close eye out for unusual bruising or red, purple, black, or brown skin marks. Depending on your skin tone, these color changes might be a bit less obvious, but they can strongly indicate a serious problem with your blood.
I also need to point out a very rare, but very severe risk: anaphylaxis. This is a serious, life-threatening allergic reaction. If you experience symptoms of this, bypass your regular doctor entirely and get immediate emergency care. Section 5. Crucial medication interactions. Proceed with caution. Colchicine doesn't always play nicely with other drugs. Certain antibiotics, like clarithromycin or erythromycin, and the HIV antiviral ritonavir are massive red flags. The same goes for antifungal medicines like ketoconazole and cyclosporin, which is often used for arthritis or transplants. Mixing literally any of these with colchicine dramatically increases your risk of life-threatening side effects. And that danger extends to certain heart medications too, like verapamil or diltiazem. Heavy-duty drugs that affect your kidneys, liver, or blood, think azathioprine or methotrexate, are also highly risky to combine with this treatment. Even disulfiram, which is a medication used for alcohol dependence, can completely alter how colchicine functions in your system. So, the golden rule here is incredibly simple. Your doctor needs to know about absolutely everything in your medicine cabinet before you swallow that very first tablet. Full 100% transparency about your prescriptions is your absolute best defense against severe complications. As we wrap up this explainer today, I want to leave you with something to ponder. Colchicine is a fantastic, super fast-acting hero for managing the sudden, blinding agony of a gout attack. But once the dust settles and that flare-up is totally defeated, what steps are you going to take alongside your doctor to stop gout from ever coming back? Looking into long-term preventative medicines like allopurinol might just be your next big move in the fight against gout. Thanks so much for learning with me today.